It has to do with the contextual aspects. And so I looked at family context. Now, I understand that, that as part of this class you read a chapter I wrote out of the family health book. And if you read that chapter and retained any of it, which there's no reason that you would, and I'm not going to test you on it to see if you did, but if you did, you would recognize that what I said in that chapter about family structure is a lot of what I say in my own model that's family context. I flipped it a little bit, and I'll say a little bit more of that as I go on here. But when I look at context, it's who's in the family, what is the culture, that's important to that particular family, where is that home located? It makes a difference if you live in a rural area or an urban area. It makes a difference if you live on the right side of the tracks or the wrong side of the tracks. It makes a difference if you live in an apartment complex in a metropolitan area versus a place where you have to depend upon transportation. It makes a difference if your father's in prison and the rest of the family is trying to survive. It makes a difference if your parents had to go to Iraq. Right? Those things all make a difference, and that becomes the context. That context is fluid. It's not something that stays forever. It's very, very fluid, and it continues to be dynamically changing over time. The community itself, where people live, makes a difference. The school you go to makes a difference, right? If you go to one school versus another school. How many children go to daycare, today? How many of you went to daycare yourself? All right? That's amazing to me. We didn't even have daycare when I was a child. You went to kindergarten was the first time you left your parents. But now mothers are working and, 6 weeks after the child is born, the mom's back to work and the child's in daycare or this very complex child arrangement care that goes on. All of that's contextual influence and has impact upon the family. Also some things like resources and threats. Do you have money or you don't have money? Do you have health insurance? You don't have health insurance. You live in an area where there is a specialist or you don't have a specialist. You have a child with a disability and you need that specialty care. It's available or it's not available. That's out of the hands of the family, but that context influences their perceptions of health and the way they actually live. Time, having time to do things. Some of you soccer moms or been soccer players or, kids are busy these days. Moms are transporting systems. Run them here, run them down, pick them back. My colleague has 9 adopted children. That was an interesting experience for me in thinking about families because I've watched her over the years raise these 9 adopted children who are culturally different and very different in many ways. But what I was particularly referring to is they're all in sports. And so she just watches half of this game and picks up this kid and go watch the other half of the game. I said, I don't know how you do it. It's like I couldn't do that kind of thing. So there's many things that fall under context that if you actually go back and look at the chapter I wrote on family, you would see that and that wasn't based on my ideas, it was based on the general thinking, that's really defined as structure.